Good evening and thanks for joining us. Ontario Premier Doug Ford warned it would be a wake-up call, and today the province's public health experts laid out in stark terms what their disease models project. These are projections, not certainties, and there are best and worst case scenarios. Here's the worst.
Over the full course of this pandemic, which may last for 18 months or even 2 years, because we may have a smaller secondary or tertiary wave. Had we done nothing, Ontario may have suffered 100,000 deaths.
100,000 deaths in a pandemic that could last 18 months to 2 years. That's if no measures were put in place to slow the spread. Of course, there are measures in place. The economy has been virtually shut down and everyone's been told to stay home and stay physically distant. If that continues and if we all obey the public health measures, the Ontario death toll is still projected to range between 3,000 to 15,000.
I appreciate that to many people, these will be shocking figures. Where we end up depends on all of us. If we follow the rules, if we do our best to socially distance, we can get within that range and we can strive to get as low as possible within that range.
The decisions we all make now will affect how many people die. Ontario's Premier was explicit. It is everyone's duty to slow down the spread of the virus, and more restrictions are coming. All industrial construction sites, except for critical projects like hospitals and transportation, will be shut down this weekend. Ford says when he saw the projections, he knew drastic action had to be taken.
Over 1,600 people could be dead by the end of April. That's 50 a day, or that's 2 people every hour.
Never in our lifetime have political leaders had to make life and death decisions like they are in this pandemic. Eric Sorensen breaks down the Ontario projections and what needs to happen to prove them wrong.
April will tell the tale in Ontario and almost certainly everywhere in the country. The worst case almost unthinkable, a best case still shocking. In this province, without interventions like physical distancing, it's projected 6,000 would have died by the end of April. With current interventions, the number of dead, now below 100, is still projected to be 1,600 in 4 weeks. Premier Doug Ford, grim but resolute.
The situation is extremely serious.
He says lives are at stake if Ontarians don't avoid unnecessary contact.
Is a life worth going to the beach? Is a life worth having a few cold ones with your buddies in the basement? The answer is no.
Like every province, it is touch and go whether Ontario hospitals will be able to accommodate the surge in patients who will need intensive care beds soon. Here's the current situation in Ontario. Right now, there are just under 200 COVID-19 cases confirmed in ICU beds. The capacity in the province has another 400 beds available. In a best-case scenario, though, the capacity is not going to be enough. The number of cases this month is projected to rise above 1,000. However, there is also a plan for an additional 900 beds to increase that capacity to meet with enough beds for the people that will need ICU treatment. In a worst-case scenario, however, there will not be enough beds available, which is why in this province and across the country, the measures being taken are so important. Ontario hospitals have permission to increase capacity quickly.
Some of them are using space in retirement homes, and some of them are actually creating field hospitals.
There is reason for optimism. Early projections looked even worse.
Very clearly, the pain we've gone through in the last 2 weeks has been largely successful. So we have dramatically changed the course of this epidemic here in Ontario, here in Canada.
And so more measures are coming, like curbside pickup for some businesses.
And if we work together, we can write the last chapter of our story.
The story will not end soon, but what happens in April could define the course of the disease for months to come. Eric Sorensen, Global News, Toronto.
This pandemic has left hundreds of thousands of Canadians without jobs. We know many have applied for employment insurance benefits. And if you applied after March 15th, you could be in for a raise. Our chief political correspondent, David Akin, has been digging into this. David, how is this happening?
Well, Donna, 2.1 million Canadians have applied for employment insurance benefits just since March the 15th. And of course, the government wants to process those applications as quickly as it can.
So the solution is to roll everyone who became or will become an EI beneficiary after March 15th into the Canada Emergency Response Benefit Program. The CERB is a flat rate benefit of $500 a week. It doesn't matter how much you used to earn or how long you were working. The average EI benefit is $400 a week. So hundreds of thousands who just got their first or second EI check could see a raise to $500 a week, and that could come as soon as next week. Now, the move from EI to the CERB will be automatic. If you've already applied for EI since March 15th, no need to apply. Now, I keep mentioning that date, March 15th. Those who applied for or were receiving EI before March 15th, those people will stay in the EI program and will not get a raise.
Now, government officials are acknowledging that this seems to be a bit unfair, and there is a general commitment to try to deal with this later. But right now, the goal for the government is not elegant program design. The goal of the government is speed. It's to get the money out the door as quickly as possible, and they believe this is the way to do it. Now, a couple of other points about the CERB.
It is available not just for those who would qualify for EI, but for anyone who has lost work because of COVID-19, and that includes the self-employed, contract workers, and so on. You can apply for the CERB beginning April 6th through the Canada Revenue Agency.
Now, the CRA says it has built a system that will be able to take in and process 1 million applications per day by phone. And let's hope they're right, because the CRA also says they're expecting 3 million Canadians to apply on the day the gate opens. Donna?
Wow. David, the Prime Minister also had news about the GST rebate. What did he say?
Well, the big news is the money's going to get out the door faster than anticipated. The Prime Minister had earlier said that he was going to double this year's annual GST rebate to $400 for a single person or $600 for a couple. And now we're learning that this one-time payment to 11.1 million Canadians is going to be direct deposited or mailed on April the 9th. Donna?
All right, David Akin in Ottawa, thank you. Jeff will continue to consult with experts and try to answer your questions. Send them to yourquestions@globalnews.ca. And on our website, you'll find a special page dedicated entirely to COVID-19. That's at globalnews.ca/coronavirus.